Okay, we know that people are now readily going to be tested for the coming days. So obviously that's going to be a big spike in the numbers of what we see. But do you feel like even beyond that, we're going to really start seeing this number surge in our area?
I expect that we're going to have a pretty significant surge now that we're increasing testing, the drive-through testing, all the additional labs are coming online. So I want people to anticipate that there is going to be a growth in those positive numbers. But we, healthcare professionals, have expected that for a while. As we get more test results back, we'll see that those numbers increase. But not to create any panic, though.
And Dr. Doe, it seems like we're all holding on a wing and a prayer right now because summer in Houston's coming, and we know it gets really hot and humid here, and that always helps us with the flu. It lowers those. Has there been any more new information come out that shows that this might lower the chances of this spreading?
Right now, we're hopeful that as the summer weather and the warmer weather starts to move in, that it may create a disadvantage for the virus. It's been that way with a lot of other viral illnesses, but at this point we don't know for sure. But as the warm weather moves in, we'll hopefully see something like that.
Well, I think it's so important for people to realize that the number of cases and who's in the ICU in the U.S. is different than it looks in Italy and in China. 20 to 54-year-olds, 38% of them are the serious cases. So we really need to be thinking about all ages. And so I think that puts parents a little on edge, even though we're talking young adults are having problems here. What about children? What about toddlers? Are they having different symptoms than adults?
Right now, from what we know statistically with the latest CDC updates, even from yesterday, age groups 19 years of age and younger aren't seeing very much illness from COVID-19. The symptoms that they may have may be nonspecific, may be similar to a cold, or they may be asymptomatic. As more testing is available, we might find more data about that, but up until this point, we haven't seen anything very severe with that age group.
And every day, Dr. Doe, it seems like more information comes out so that we can better understand this particular virus. At this point, how long does it look like COVID-19 can stay in someone's symptoms when they never have symptoms? And we realize there are carriers out here that you don't even know about, and you never will know about them.
Right, and I think that's the reason why we're seeing some community spread and some folks who haven't had any travel to any of the countries that were hotspots. The virus, we understand, can last for quite a while. At this point, we're using a 14-day quarantine period. The contact services, may last days. So it's very different from what we've dealt with in the past with some of the other more mild colds and flus in the past.
Well, and a lot of our viewers are asking us, is it even worth getting tested if there is no cure? What would you say to them?
I think if your symptoms are mild, you don't necessarily need to be tested. Right now, that testing is a very limited resource. We want to reserve that for those we have to make important medical decisions for. There's a lot of folks who are ill, who are in the hospital, who may have COVID. We want to reserve the testing for those who really, really need it. If you're having mild symptoms that are very cold-like or very flu-like, mild flu-like that you can manage at home, continue to do that. Continue to keep yourself away from others and use the over-the-counter meds that may provide some symptomatic relief.
And then know if you test positive for it, everyone in your family needs to stay home, all of them for 2 weeks, right?
Yes, that's correct.
All right.